So welcome to our seminar today. Glad that you've joined us, whether it's good morning, good afternoon, or good evening. We will be discussing an exciting opportunity provided to you through the FIP Ed Hub group in particular, but a collaborative effort talking about a global approach to pharmacy workforce development. In particular, a highlight of today is the launch of the FIP Workforce Reference Guide, but we will be hearing from a number of our leads talking about a number of activities that are going on within FIP. So I'm Jill Boone, and I'm co-chairing this morning with Jared McMaw. Jared? Thanks,
Jill. So yes, I'm co-moderating today, and I'll introduce Jill and give Jill's background now. So Dr. Jill Boone is the Director of Interprofessional Education, the Coordinator of Co-Curriculum Program, and the Professor of Pharmacy Practice at James L. Winkle College of Pharmacy at the University of Cincinnati. Jill is a past President of the American Society of Health System Pharmacists and past Co-Chair of the International Pharmaceutical Federation Working Group on Collaborative Practice, and is one of the Workforce Development Hub Associate Directors for FIP and an FIP Fellow as of 2020. Thank you, Jill, for tonight's presentation.
And Jared is the Pharmaceutical Society of Australia, the CEO, I guess, or President, or the Pharmaceutical Society of Australia.
I work for the Pharmaceutical Society of Australia, okay. Not as the CEO.
So, he's a project pharmacist and developed models of care that utilize pharmacists in non-traditional primary secondary settings. He is a major contributor to the National Workforce Development Strategies and a hub lead for Work Development Goal number 9. So as you've already determined, Jared and I will be tag teaming this morning. And it's my pleasure to go ahead and provide some additional information about the seminar for getting us started. So first of all, the webinar is being recorded and live streamed via Facebook. So want to make everyone aware that whatever is happening here is being recorded, and it will be available to you after the session at our website. When you ask questions, we ask that you do that in the question box. The question box actually will be recorded so that we can later publish any answers to questions and we can keep track of them. We encourage your conversation in the chat box, and I love to have lots of interaction, and a lot of times questions will be asked there. And we'll try to capture those, but if you have a specific question for the speaker or for the session, please include it in the question box. And then we love your feedback. We want this to be a very informative, engaging process in this webinar and in future activities. So we welcome your feedback in webinars at FIP.org. And if you're not, join us as a member at this following website, FIP.org, membership registration. So today is a complement to some recent activities focused on some of the work development goals. Last week, or really over the last couple of weeks, the work development groups from several of our work development goals have presented, most recently focusing on equity and equality for pharmacy, also looking at the impact of COVID and the work that a number of our working groups have focused, as well as the launch of the sharing and launch of the new survey that was done last week, and talking about additional transformation strategies. So over this last month, the work development groups that are highlighted here in yellow, 2, 3, 4, 5, 7, and 8, and 10, have all provided at least some input into what's going on within their group or FIP. And what we plan to do is that we'll be balancing that today and having additional groups present And the groups that have not presented in this week, we plan over the next 6 months to have them to provide information about what's going on with each of the working groups. It's really important that we partner with everyone involved in FIP, and one of the ways that we feel this is important is to provide you an update of what these working groups are doing. So today, this launching session will start with the contextual introduction on the FIP Workforce Reference Guide, which currently focuses on the work development goals 1 through 13. As we know, we've expanded those this week or this month, and so we're very excited to have done that. This reference guide first starts with a focus on 1 through 13. During this event, it's a very exciting experience because the whole guide will go live. And all of the working groups that have been spending a lot of time and energy will be making the current products and services available that are going to be available to all of FIP, as well as activities that are ongoing. 5 of the 13 groups that I mentioned earlier will be presenting today. The working group on quality assurance, working group 3, 5 on competency development, 7 on service provision, 8 on working with others, and then 10 on gender equity and diversity. So our learning objectives today are to indeed launch the FIP Workforce Reference Guide, which is a global resource for transforming the pharmacy workforce worldwide, to highlight the importance of this reference guide in supporting members and stakeholders, and then again, to hear the activities and products of the 5 development groups that I mentioned previously. Lastly, we really want to engage you in the work and the activities that these development groups are in the process of. So we welcome your comments, your suggestions, your reactions. Please put them in the chat box. Please email us after the session. We're very excited to be partnering with you as we all try to make this world a better place for pharmacy and for our patients. So it's my pleasure to introduce our first 2 speakers. Professor Ian Bates, I needs no introduction, but for a few of you out there that may not know him, he's the chair of pharmacy education at the University of College London School of Pharmacy as head of the educational development. And he is editor-in-chief of the Pharmacy Education and International Research Journal, housed by FIP, and has been publishing peer-reviewed educational research continuously since 2000, so 2 decades. He's also a fellow of FIP, Royal Pharmaceutical Society, Royal Statistical Society, and a trustee of the European Pharmaceutical Students Association. And he is an amazing leader within FIP and within our hub. Dr. Lena Bader also is a star. She's UK trained and a registered pharmacist. She's the FIP lead for workforce transformation and development, and her workforce focus is transformational of the global pharmacy workforce through country level partnerships. So we bring to you a great deal of expertise and experience, and we look forward to hearing more about the Workforce Reference Guide. Ian?
Thank you, Jill, and for Jared for kicking off this important session today, where we are launching a new tool, a set of tools really, to help with workforce transformation. While we digest that short but critical message on screen at the moment, let me pay tribute to my colleagues who are on the event today, who are speaking and showcasing their work, and all the other global leads at FIP who comprise the hub, who have been critical to the development and launch of this resource today. There are 40 in total. You will hear from some of them today, and I remain in awe of their intellect, their energies, and their commitment to provide global structures for our profession, and all of the billions of citizens to whom we provide direct healthcare, medicines expertise, and health improvement. So that's about the widest context I can provide. This is truly a global mission. And I would hope that everyone would understand that improving global health through pharmacy, through pharmaceutical practice, sciences and education is an important and undeniable role and job and vision for all of us throughout the world. However, I do need to hone down a little bit, and the next slide shows us where workforce becomes so critical for us. WHO documents on the screen in front of us now, really aligning us with this notion that there is no healthcare without a workforce, and healthcare reform, healthcare transformation has to start with workforce transformation. We can't do it the other way around. And WHO have expended a lot of energy and thinking on how we re-strategize human resources for health. And that includes increasing capacity, because we are chronically short of healthcare workers worldwide. Those shortages are also uneven. So low middle income countries seem to bear the brunt of shortages. And this is in the context of increasing complexity of medicines, increasing comorbidities, people living longer with more diseases, taking more medicines. We have never been more important and critical for global health, and in particular primary healthcare communities, than we have right now. And you certainly don't need me to remind you of the current pandemic which is going on, which again has highlighted the critical value and impact that pharmacists have. But workforce is key to it all, and that's what we are focusing on today. So let's go down to another level of focus, which is where we've been working now for the last decade, really. 2016 was an important year for us because we launched the Workforce Development Goals, which was the first time a health profession had set out a systematic framework for restructuring, redeveloping, and transforming an entire workforce. And remember that pharmacy is the third largest health workforce in the world. It's the third largest workforce in any country, I think, and it's critically important for primary healthcare and medicines expertise. Following on from that, we rescheduled, reformatted the work of FIP in 2018 with the development of the Hub, which is a 40-strong international team, very diverse, very inclusive, and very member-facing, that have developed a whole range of tools and policies and mechanisms, which have fed into our workforce transformation program. And this is where we work in partnership with countries. We'll be hearing more about it later from Lena, and actively support transformation of pharmacy workforce in order to meet our future healthcare needs. There's a picture there of one such event in Jordan, an agreement being signed and put into place there. Last week saw another major development, and FIP have taken the concept, the proven concept of goal-oriented restructuring and transformation, and have extended this into development goals, which encompass not just the workforce, but practice and service delivery and pharmaceutical science as well. And our colleagues who you will be hearing from today will be talking about some of their important and critical work in extending these areas into for the first time ever, a global set of integrated, systematic, comprehensive goals to aid, support, and shape transformation of pharmacy worldwide. It is a unique milestone in pharmaceutical history. So I think there's another level we can go to, even as we move down this contextual outline. We did use the original workforce development goals as a basis for extending, but as I say, there is parity now between these three areas of science, workforce and education and practice in these 21 global development goals. So we've lost nothing from the original 13 pharmaceutical workforce development goals, the WDGs, and we've gained an awful lot more for our mission and vision in the next 10 years. And just to nail this home for you completely, this is about integration. And the next slide finishes this message, saying that, you know, we cannot really separate out practice, science, and workforce. It's unfeasible, and it doesn't reflect real life. And these goals, if they are to be useful and valid and credible, have to reflect real life and the challenges we all face as practitioners in real life trying to deliver pharmaceutical healthcare. So we are about integrating these elements together into a set of one FIP goals, so that we can progress and transform and develop. But the next slide is about the implementation, and for today we'll be focusing on workforce and education. All right, but I don't want us to forget that we are now working within this context of integrated development goals. But we're going to home in today on an important and critical toolbox we're launching for workforce and education. Our implementation plan will be regional, first of all. Regionality and countries communicating together in regional adjacencies is now a plan. Generally, we're going to call them roadmaps, and generally that's the level we'll be working at before we hone down into individual nations and countries. But we are very, very keen on regionality, and we see a lot of impact and influence coming from regional engagement and regional cohesion. Of course, indicators and metrics are going to be critical, which is why the Global Pharmaceutical Observatory is going to be a useful tool for everyone. And we'll be feeding all of this stuff into transformation programs that members, i.e. countries, can work with FIP and work with other countries as well. We're very keen on this horizontal adjacencies. We can work together in order to help with practice and workforce transformations. Super good. Let's just have a quick look at the transformation program for workforce. We already have projects up and running, which are cemented into concrete actions by MOUs, Memoranda of Understanding, and partnership agreements. And we are now embarked on this huge program of country level support. And that takes a lot of energy and enthusiasm and vision and brain power. And I feel very humble once again working with colleagues on this call today and with the wider Workforce Development Hub, because you do all make me feel like an imposter, I have to say. You're so good and talented at what you do. So I've got a lot of hope for our successes over the next 5 to 10 years. I think probably a final slide from me, just to set the bar, just to set the expectations as high as I can. And this is a slide which shows us where our strategic key issues are, from engaging at the highest level possible with WHO. And remember that our senior leadership in FIP, Dominique, our president, and Catherine, our CEO, signed a formal MOU with WHO very recently following Astana and the reformatting of primary healthcare, which again was quite remarkable. So we are on this journey now. We're there. We've agreed to do the journey with WHO, and maintaining that high level engagement is pretty critical. And of course, partnerships and collaboration are going to be part of that. How can it not be? Data and evidence, again, has to be part of this. It has to be. Making sure we have, if you like, a modus operandi, a way of working with partners and members. So the adopt, adapt, and sustain policy that we have is critical for success. This is not FIP imposing things, telling people what to do. This is FIP supporting nations to move forward and being an equal partner in that development. So adopt, adapt, and sustain is a personal philosophy, personal policy, which I am super keen on, which of course involves members and member engagement. Utterly critical. If we could have a central spot on here, it would be members, member organizations. Tools, mechanisms is of course vital, and that red circle there shows you what we're trying to do today. This is a culmination of lots and lots of tools and mechanisms put together into a reference guide so that people can understand what we can do, understand tools, understand mechanisms, and work with us for transformation programs. And finally, let's get to where we are today and what's happening today. And this is the reference guide. We thought of lots of labels for this. We were going to call it a handbook at one point, or a toolbox and such like, but I think we need to keep this organic, and it needs to keep evolving, this reference guide, and we need to keep adding to it. So this is not a final thing that you're seeing today. This is simply a launch of a starting point, which will be consolidated, expanded, validated as we move through into our 3, 5, and 10-year phases, because that's how far we're looking ahead at FIP. We're looking at least 5 years ahead, probably 10 years ahead. Workforce transformation is a slow turning ship. We're starting to put the rudder on the ship, and it's slowly beginning to turn, but workforce, just by its very nature, takes a while. And we will be keeping our foot on the accelerator as we move into our 5 and 10 year planning here. We're very patient, we're very persistent, and we will make this happen. So we're launching the guide. Who better could I hand over to now than my colleague, Dr. Lena Bader. Over to you, Lena.
Thank you very much for that, Ian. Indeed, a very important moment. I'm just going to ask Jill to go back to that slide because it has, well, the pictures of people we couldn't have done this without, but it's not just the global leads of the hub, but also everybody who's been part of this hub and previously the education development team, including volunteers and staff, and really is a huge feat of work building on a legacy that has been going on for years and years and years. So what is the guide? The guide is actually a digital guide, and we decided it would be digital because we did very much identify that it's something that will be continuously updated, reviewed, refined, and expanded with all of the evidence, tools, and frameworks that we continue to build and develop. That's why it's digital and very easily accessible for everybody. And the guide includes information, evidence, and expertise from FIP to support our members with measuring progress, identifying their needs, evaluating where they are, implementation and transformation of the FIP development goals, specifically the workforce elements of these goals. And like I said, it is a continuous body of work that we will continue to work on. And the next slide, please, will show us how this fits within all of the tools and mechanisms that FIP offer to support our members with transforming the global workforce, one country at a time. And we really are aiming at national level transformation, but of course, all of our tools and mechanisms can also be used institutionally as well as individually. We're making sure that our guidance and implementation tools address all of these levels of implementation. If we just go to the next click, please, it will just run through very quickly. So of course we have the hub, which produces the work, which has produced all of this work, building on legacy of use and use by FIP, the Workforce Transformation Program, a program that allows for country level partnerships and really is the solution for implementation through working with our members. Of course, we can't do it, as Ian has already alluded to, without data, without the intelligence that we need to build on to identify needs and to help our members know where they are and where they need to go. And of course, regional roadmaps, which was one of the important mechanisms for the FIP development goals. So it all really fits together within this, aligned with the FIP mission. And the next click, of course, member engagement is key to this. And of course, through events like this in 2020, but also physical events that we've run in the past, regional conferences especially, we really rely heavily on these to ensure our members are engaged and are aware of everything we can do to support them. And of course, and that's also another key mechanism for implementation, we ensure that all of the work we do, especially that the work that is policy oriented, is aligned with World Health Organizations, and that's where we start from the top. And in honor and of the FIP MOU with WHO, but also our commitment to global health generally. And the next one then shows how the FIP Workforce Reference Guide is another addition to this library of resources that FIP offers. And they're all interconnected to help with transformation. The next slide shows how the Workforce Reference Guide now fits within this timeline, which we have shown time and time again this month to all of our members. So we have delivered on our commitment since the launch of the Workforce Development Goals in 2016. The hub was commissioned to develop evidence and tools and frameworks for the implementation. The transformation program was another implementation solutions to work directly with countries. And of course, the FIP development goals, delivering on FIP's mission to transform practice, science, and education. And the Workforce Reference Guide is now delivered by the Workforce Development Hub to support our members to implement the elements, the workforce elements of the FIP development goals. The next slide also shows importantly that while the FIP Workforce Reference Guide currently covers the FIP development goals 1 to 13, for obvious reasons because it builds on the original workforce development goals, work is underway with FIP partners, members and volunteers everywhere to expand this guide for the other FIP development goals workforce elements. And we'll proceed to the next slide because there's no better way to show you the guide than for you to actually see it. So just before I move on to my browser, I wanted to just give you a moment to see the screen. So the guide can be accessed through a number of web pages on our main FIP website. We've also added that QR code that you can screen with your camera that takes you to the main landing web page, fip.org/workforce reference guide. And if you don't mind, then I'll just take a couple of minutes of your time to actually show you what this looks like and invite you to continue to browse through this as the session continues. And we'll share these links again via that chat shortly. I'll just try and share my screen now. Great. And I'll actually show you how you can access the guide through these 3 different web pages and showcase a couple of these, actually three of our FIP DGs. So the first landing web page is the main one, fip.org/workforce-reference-guide. Of course gives some background to the Workforce Reference Guide, but really quickly allows you to jump into the guide. And you'll see here that the FIP Development Goal icons refer very clearly to the workforce element. So you can click on any of these, and if we click on number 1, will take us to the Workforce Reference Guide for FIP Development Goal 1. So what does each guide, and we have 13 of these at the moment, so what does each guide include? So it includes, again, reiterating what the goal is about, especially this workforce element, what we globally are aiming for, what the mechanisms of this FIP development goal are. You can go back to all of the FIP, the fuller FIP development goal 1 with its practice and science element easily here. We are linking all of the FIP reports, and of course this is a work in progress, and we are still expanding this list that we have done that thematically and more directly link with this work. FIP publications that have emerged from the work of our volunteers during their tenure as leads, and also all of the related events and training opportunities that FIP is offering. And of course, this will be expanding as FIP expands its provision program. So these are links to all of the events that we've delivered that again, thematically linked to this goal, telling you more about who the global leads are for this, so to help you engage and be aware of their work, links you back to all of the other leads as well. We also wanted to add, because this we feel that is something we wanted to engage with our members further, tell you more about the ongoing projects being driven by these leads. So we'll always keep this updated to let you know what's going on. And should you want to reach out to you about a specific issue that you want to contribute to. And the leads have also attached here some additional resources, bibliography, and further reading to support the understanding, implementation, and progress of this goal. So that's one way of accessing the guide. And this was the guide for academic capacity. You can also access the guide through the main landing page of the FIP development goals. So of course, this links directly with the FIP development goals. So fip.org/FIP-development-goals. If you go down, we have made it we have given you this really nice clickable map to explore the goals. So if we look at goal number 4, for example, advanced and specialist development. So this page takes you to the full description of the goal, which again includes the workforce, practice, and science element. And if you scroll up again to workforce, you'll see here we have linked the FIP Workforce Reference Guide for this goal. So we'll click here again, and again takes us to the Workforce Reference Guide for FIP Development Goal 4. I've actually chosen this goal to highlight because some of you may already know we have launched a new framework, well, an updated framework that serves to implement this goal, the Global Advanced Development Framework. So you'll see that the framework is linked here. All of our previous reports in relation to this goal are here. Publications that have emerged from FIP using our data, events, training, again, who the leads are, also our collaborators. So we wanted to acknowledge all of our interns and volunteers who are supporting the work of the goal, ongoing projects, again, bibliography and further reading. One final minute from me, actually a few seconds, to show you the last way you can access the Workforce Reference Guide. We have given you no option, you have to access it. It's through the Workforce Development Hub webpage. So this is an existing webpage we have telling you more about the hub, who we are, what we do, and we've made sure that we have a link here to the Workforce Reference Guide. So we'll just scroll down here again, we'll go here again. And finally, I'll take you through number 2, because I wanted to take this opportunity to remind everyone that, again, Global Leads of number 2 have launched a framework, an updated Global Competency Framework version 2 last week, and that's linked here alongside version 1. And again, same categories for everything else. And I know that we have other leads showcasing other pieces of work, so I'll let them do that, but I just wanted to select these as examples. So thank you in advance for visiting these, exploring them, giving us feedback. We continue working on this and refining it and improving it. I'll add the links to the chat and welcome any questions. Thank you very much.
Thank you, Lena, and thank you, Ian, for just a very exciting announcement for this resource. And I look forward to hearing more about some of the specifics from some of the groups today that will be presenting. But in the meantime, we have a couple of very special guests that we'd like to invite to speak, and that is our president of FIP, Dominique Jourdain, as well as our CEO, which is Ms. Catherine Duggan. And so we're very excited to have you here as a part of this launch and a part of this celebration. And let me turn the floor to you.
So thank you so much, Jill. I'll take a couple of minutes before I hand over to Dominique for his wisdom and vision. What a pleasure it is to join you today. Last week, we named the entire week World Pharmacy Week so that we could celebrate the impact of the entire profession and all of our teams during this time of COVID. And that week culminated in World Pharmacist Day on Friday. And last week we launched a lot of things, a lot of initiatives. There was a lot of work to be able to showcase. And what a great feeling it is that that work hasn't necessarily finished and we have this continuous progression, which I think is so super. Thank you. So I wanted to just outline for you a couple of thoughts. The FIP principles really have worked for more than a century now about building on strengths, building on the volunteers, and building for the future with the strengths of those volunteers. I see 6 things that are really important for this work and how we can adapt this to wider FIP. And I know Dominique will build on this. Politics, policy, imperatives, tools, support, and data. So the politics are right for pharmacy. Since 2018, on the renewal of the primary healthcare agenda through Astana, and the absolute alignment of that with our vision for access in the world for safe and affordable and effective medicines means that pharmacy is truly aligned front and center. The next piece is the vision of our president, which is the policy piece, the one FIP. There are no room for silos. It takes us 3 times as long to do anything if we have 3 different structures doing things in different ways. And by sharing a vision and sharing a mission, we can unite around one FIP. The third thing is the imperative. And again, our president set the timeline for his presidency that by 2022, in Cape Town, then we were going to have a health ministers summit. We've had to push that out now for a year because COVID has got in the way of our plans, but the timeline really sets our feet on burning coals here. We want a health ministers summit. We want to demonstrate the impact we have had across our regions at that summit. And the ways that we are going to do that, colleagues, is by setting goals that unify our profession. Tick. Those goals now are published. The 21 goals were launched on the 21st of September, which is super pleasing for the nerds amongst us. But what we really need is to operationalize goals with tools and mechanisms and support. And they're my number 4 and 5. You cannot do anything to achieve the action that our president and our organization require of us without support. And we have that now. We have a guide that shows us how we can do it for workforce. And this is the template and the blueprint we can use for science and for practice. And this will set the forward trajectory for how we support our nations. The 6th and final point I wanted to make was data and evidence. Without evidence of impact, we are, as my president would say, we are nothing. So we have our GPO aligned to support us with the delivery of these goals over the decade ahead. And that way, FIP can seek to play our part in transforming global health. And through our regional forums and our regional organizations, we can transform health regionally. And then through you in your nations and your localities, we support our communities and society. And let me just say one final thing before I hand over to Dominique. Without pharmacy during 2020, all our communities would have been worse off and in a worse position than we find ourselves now. If there was any imperative around the need for pharmacy to deliver primary health care, this has been proven through the challenge of 2020. Thank you, colleagues, on this event, and thank you so much to the Workforce Development Hub and for all the work that preceded that. Without you, we would have no foundations to build from, and without you, we would have no way to draw our volunteers in to deliver the vision of FIP. Dominique, over to you to deliver one FIP.
Thank you very much, Catherine. Everything has been said, so that I will be very short because I am very impatient. On the contrary, that what Ian Bates said in the beginning, we are persistent, yes, and we are patient. No, we are impatient to reach our goals. But what I want to say is one FIP strategy can only be implemented if we have the tools that will be used by the members organization and the members and the pharmacists in the field. It's the reason why your work is very important, to give guidance to the member organization how to do that. And if you noticed until now, every or the one FIP strategy has pieces of puzzle. One of them is the work done by the hub. The other one is GPO. The other one is development goals to reach or to be successful with our strategy. What we noticed in the past, we had a lot of very good report, but nobody knew what or how to implement what was within the report. So that your work giving tools to the member organization to implement projects, to implement new services, to implement a new curriculum, education, and so on, and science also very important. It's the key for the success of our strategy. And the last thing I want to say, I want to thank you, all of you, because the competency that you are bringing within FIP is a proof for your dedication and your engagement for FIP. And I mean, the steps forward we did the last 1.5 years or 2 years is principally thanks to your competencies, and we hope that COVID-19 pandemic will stop soon, because now we need to meet. We need to have the contact with the people, to motivate them, to support them, to go further, to discuss with the government for regulatories, for a lot of things. We need this contact, and we need to prove all the governments that the work of the pharmacist is crucial for to reach the universal health coverage. So that, thank you again for your work, and I am very impatient to learn about what you have to say. Thank you very much, and enjoy the session. Back to you, Jill, or
Jared. Thank you, Dominique, and thank you, Catherine, for your words. Now we will move on to, I guess, the main event for tonight, to hear from our Workforce Development Global Leads. So first we're going to hear from Dr. Nadia Bakari, who is an academic pharmacist at University College in London and a chief pharmacist at the digital health platform known as Doctors, which puts people in contact with female doctors around the world, and is one of the global leads for Working Development Group 10, Gender, Equity and Diversity. Thank you, Nadia.
Thank you so much, Jared, and I have unmuted myself. Thank you for that kind introduction. And if I could hastily add there, with regards to Doctors, on World Pharmacist Day, we also launched the integration of the female pharmacist into the telemedicine healthcare delivery system, which we're very excited about. So it's a first really for Pakistan, and we think it's a global first as well. So thank you so much for that. So I'll be giving a quick lowdown with regards to WDG 10, and if you could change the slide, please. So here we have the FIP Development Goal 10, Equity and Equality, which is split into 3 main sections: workforce, practice, and science. With regards to workforce, we have we hope to have clear strategies for addressing equity and diversity inequalities in the pharmaceutical workforce development, continued education and training, and career progression opportunities. With regards to practice, clear strategies for equity and diversity in pharmaceutical services delivery, service access, and service impact, so that all people have access to quality pharmaceutical care. With respect to science, we would like to see equity in a global capacity of pharmaceutical sciences training, research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. Next slide, please. Thank you. So here we can see our logo or emblem for FIP DG10 or FIP Equity RX. And the three elements are the three hands of care in pharmacy, which explains where we have come up with this logo, meaning we are leaving no one behind. Very, very powerful. Next slide, please. So the FIP Equity RX and FIP's Equity and Equality Programme will support the progress and implementation of FIP Development Goal 10 locally, regionally, and globally. And I'd like to take this opportunity now, if you could please move on to the next slide, to introduce my colleagues who are also global leads within this development goal, Vibhuti Arya, who's based in the US, and Carleen McNair, who is based in Australia. And together we've been working tirelessly, working very hard, and we make a fabulous team. So kudos to the ladies on the team as well. Next slide, please. So just to give you a little bit of an overview of the kind of work that we are engaged with, and these are all work in progress at the moment. So the first one is a call for action for gender equality for the pharmaceutical workforce during the COVID-19 outbreak. And the call to action, these are all in line with the commitments made by FIP to address equity and equality in pharmacy. In May 2019, FIP launched FIP Equity RX, which was a landmark global program for championing women in pharmacy and healthcare. In the first Equity RX collection, which was published back in December 2019, FIP announced plans to expand the scope of its equity program in 2020 beyond gender and diversity balances, extending this exclusivity to equity and access to care and all that this encompasses. FIP also announced plans to launch a commitment to equity in 2020, and the commitment will serve as a roadmap for concerted actions towards equity and in pharmacy and support driving both the contribution of pharmacy towards a better and more inclusive world for all, as well as monitoring the impact of the FIP Equity RX program. So within this call to action, we have asked for promotion in gender and diversity balance in the pharmacy workforce, as well as including female voices in decision-making and leadership roles in pharmacy, and also provide decent work environments and address harassment and violence. Aside from that, we are currently working on a workforce reference guide, as Lena had mentioned earlier, and we are contributing to that for DG10. A national tool for member organizations, which I'll shortly expand about. We are also launching a Women in Workforce survey, commitments to equity and equality, and digital events as well. In addition to that, the team has contributed to articles within the Equity Handbook. So we have produced articles on sexual harassment, violence against pharmacists, domestic abuse, pharmacists looking out for domestic abuse, and maternity issues, but also pharmacists who are going above and beyond their role during the pandemic. Next slide, please. Oh, we've gone really ahead. Sorry, Jared, we'll have to go back another couple of slides. Okay, so it seems like there's a slide missing. No problem. So I was going to expand on the national tool, we have a current model within Pakistan where we've launched the National Alliance of Women in Pharmacy, which has been a great success, and it's been over a year and a half that it's been active. So using that as a model, we are now developing a national tool of how to set up an alliance, how to set up a gender equity hub within your nation, how to get other groups and stakeholders involved, how to conduct a needs assessment, find out what data is available within the country, and identify any gaps that can lead to data intelligence improvement. Next slide, please. So just looking at the digital events that WDG 10 has been involved with. So we have, back in 2020, June 2020, we contributed to the webinar of challenging the narrative of leadership in gender equity during the COVID-19 pandemic, as well as COVID-19 Women Front and Center. And in August, we contributed to a webinar of highlighted inequities in pharmacy education due to COVID-19, where we had learnings from Africa, Asia, and Latin America. And this was organized jointly with FIP, UNESCO, and UNITWIN. Next slide, please. So here, just to give a very quick snapshot of work that falls under our development goal, which FIP has very strongly supported and feeds into #EquityRx program. So I've already mentioned the National Alliance for Women in Pharmacy in Pakistan, which was founded back in April 2020, where we are focusing on supporting the female pharmacy workforce and to support, enable, and recognize female pharmacists and give more visibility to female pharmacists. In addition to that, we are very excited that we will be launching a Gender Equity Hub, which is a joint collaboration between UCL, Hamdard University of Institute of Pharmaceutical Sciences, the British Council, and FIP. And this hub envisages to address gender inequities and develop transformative gender and diversity policies for the pharmaceutical workforce in Pakistan. And we aim to create clear evidence-based strategies for addressing gender and diversity inequalities in the pharmaceutical workforce in Pakistan as well. So we are very excited for that, and that will be launching very, very soon. And doctors, as we know, during the pandemic, there have been many issues with regards to gender equity, which have been highlighted, but how we have also seen digital technology, how this can act as a tool and provide support within the pandemic as well, and especially increasing access to healthcare. As Jared introduced, the organization, it's a leading telemedicine provider in Pakistan, and we focus on employing a predominant female health workforce. And we have now incorporated the female pharmacist into that platform as well. So it's a very, very exciting time for pharmacy in Pakistan and globally as well. So thank you very much. That's me.
Thank you, Nadia. Sorry, I just had some trouble turning my own section back on again. Now, before we move on to our next speaker, I'll just remind everybody that we do have the Q&A option at the bottom there. So if you have some questions that you would like to pose to our speakers, please use the Q&A section. Even if we don't get time tonight, we will ensure that we have a way for people to be able to make their answers available afterwards as well. We'll now move on to Dr. Abir Al-Ghanaim, who is Professor of Pharmaceutics and Biopharmaceutics at Sullivan University and one of the Workforce Development Goal 3 Quality Assurance Leads. Thank you, Dr. Abir.
Thank you, Jared. Good morning, everybody. Good afternoon, good evening, wherever you are. It's really amazing to be with all of you through cyberspace, and regardless of your region, your timelines. It's a pleasure to be with all of you today and to represent my team. Can we have the slides, Jared? Thank you. First of all, I would like to represent my team, and with the second slide, talking about our leads for the WDG3, the quality assurance. We have Bronwyn from Australia, Abby from US, and Banan from Qatar. I'm representing my team, and we had a very amazing team working together, trying to implement and develop a tool for quality assurance, and I'm going to be walking with you through our work for the past year and hopefully what we're planning to move forward with. So the quality assurance WDG3 team worked diligently with trying to analyze a report, and as Lena mentioned, there will be a publication coming soon about the data analysis and a summary report publication for the work that has been done as a collaborative work between the FIP, UNESCO, and Unit 1. Our team, in fact, helped analyze the survey outcomes, put the report, and put some recommendations moving forward. The work that we were engaged with, data analysis and summary report, was basically in the sub-Sahara countries, basically covering 7 African countries: Ghana, Kenya, Nigeria, Zambia, Uganda, Malawi, and Namibia. Basically, the survey covered quality assurance, accreditation system, and part of curriculum review of pharmacy degree programs. Moving forward, I'm not going to go over the report in details, but I'm going to go over some of the outcomes just to share with the team here. Next slide, please. So when we look to the surveyed countries, in fact, we found that based on the outcomes, they are facing really challenges in areas of quality assurance and pharmacy education that would require really an immediate intervention by stakeholders to ensure that maximizing the quality of pharmacy education and practice. They do have amazing programs, amazing systems. However, implementation of quality assurance is a must to ensure that there will be continuous assessment as well as feedback to ensure or assure the quality. Based on the results of the survey, there were several accreditation bodies within the same country that would go from different directions. So definitely our team, based on the outcomes of the survey, put a recommendation that it would be very beneficial to have a merge of the different accreditation bodies within the same region or the same country or the same city, in order to ensure that there will be a universal set of standards among those areas. I'm just talking about basically the same country or the same educational system within the country, trying to have some sort of communication between the different accreditation bodies within that system to ensure coming up with the standards that would enhance competencies among pharmacists, students, as well as in practice. Next slide, please. Well, the surveyed African countries, they are definitely fertile with pharmacy education and opportunities in terms of the growth and innovation. There are plenty of opportunities and chances available there. There are chances to expand their pharmacy education and practices, to have more extensive fellowship, more clinical practice, more residency training programs, but definitely there should be a lot of investments to enhance the quality assurance system to be able to expand on those areas. Based on the survey also, the schools had, in fact, operational curriculum review policy, which is really amazing. And in average among those countries, it was between 3 to 5 years. They are really important to implement those and ensure there will be a continuous curriculum upgrades, as well as ensure there will be a continuous assessment at the level of the faculty, level of the administration, ensure students' feedback is there, and introduce the problem-based learning systems. Next. So a reflection on these problems and possible solutions, basically FIP to form educational partnership and provide critical training, which is really ongoing and in fact enhance more the resources to support quality education and accreditation standards. In fact, there will be always innovation in the teaching process. Definitely those has to be implemented and enhanced to keep up with the training modules and with the pharmacy education innovations as we move forward. There should be a continuous curriculum developments as well as a review. In order to provide a pharmacy practice experience and quantitative reasoning skills that would definitely provide more opportunities for interprofessional education to enhance the collaborative efforts, not just at the level of education, but also after graduation and being able to work within a health team. Develop collaborative relationship and partnership with the stakeholders, and this is really important because look at the surveys, it's important to have some sort of feedback from the stakeholders and basically those who are mainly involved with the education system and practice. And we're talking more about administration, about faculty, about students. Their voices has to be heard to ensure that their input will help support and advance the mission and goals within those countries. Second slide, please. So if you look to the conclusions and remarks, and as I mentioned, I'm not going over a lot of details. I just would like to reflect on our team outcomes and recommendations based on what we read and what we analyzed. There are a lot of things that can be done to enhance and move on with beautiful quality assurance for the pharmacy education as we are working to develop those tools. But definitely there are some recommendations that can be taken into consideration. Basically, the FIP to work or to form educational partnership and provide critical training and resources to support the quality education, as well as competencies for accreditation standards. Definitely enhance the methodologies of teaching, make it more like, into problem solve and, more into agreement with what's going on with the advances in pharmacy education. Provide a continuous review of curriculum as well as enhancement, activate the assessment cycle of getting feedback and moving forward with quality assurance to ensure a good quality of teaching and practices. And of course, develop collaborative relationship and partnership with the stakeholders. And as I said, this is really important to advance the mission and the goals. Second slide, please. So our team is working to develop this beautiful, nice, multi-level quality assurance tool, and we decided to go with 3 levels. And somebody might ask, why don't you put one tool? Well, we want to make sure that we don't put a lot of questions, and we would like to get the best outcome of those tools to help us put those levels of understanding among the countries. So we're making developing currently a tool, quality assurance tool or survey at 3 levels. And this is basically to cover the wide spectrum of quality assurance environment and management globally as we are digging into understanding more in the countries, the quality assurance systems. We are finding a wide spectrum. So maybe one tool might not be sufficient to cover all at a global level. So we're working at 3 levels, and hopefully soon we'll be able to share those tools. Definitely when it comes to pharmacy practice, there are a lot of, and pharmacy education, there are a lot of things has been changed recently, evolving among in enhancing the role of the pharmacist as a vital and crucial team member within the healthcare providers. And definitely we need to ensure that from quality assurance, when we build those surveys, that we are helping getting feedbacks to better enhance the pharmacy education. Second slide, please. So in general, our recommendations basically to establish standard-based a global guidance. However, this global guidance for quality assurance would have a global vision or a global coverage. However, it will more focus when it comes to pharmacy and pharmaceutical sciences on the context of local needs and practices. Definitely, like, you know, each area or each country would have its own local needs and practices that we want to work with, but we want to ensure when we put those quality assurance standards that it would be having a global coverage, a global vision, but also take in consideration the context of local needs and practices. Definitely, we need to work on implementing effective, transparent, and fair policy and procedures for quality assurance of pharmacy and pharmaceutical sciences education and training, as well as ensure there is a continuous development and delivery of adequate and appropriate education and training systems, and that would be through using those quality assurance tools and putting that outcome there. So definitely continuous developments and enhance or ensure that the stakeholders' feedback is involved within the educational system as part of the quality assurance tool to ensure that there is always enhancements in the education and training, as well as assuring the vision and mission of the educational systems. And by this, I come to the conclusion of my talk with the second slide, please. So I would like to thank basically, first of all, my team, WDG3, amazing, beautiful minds working together, spending a good time and good efforts diligently to ensure that we are putting our efforts and time to help with enhancing the quality assurance and providing that tool that will help us down the road to build some standards and be able to share with everybody and publish that. I would like to thank Nihan, who provided us with the opportunity to help with the reports for the FIP Unit 1 UNESCO type work, the work that we analyze and we write the report about for the African countries. I would like to thank Melody Okiroki, basically the FIP Unit 1 intern, who helped us also put the introductory part to the chapter or to the report on the sub-Saharan countries. Zainab Abdeen, she's a master's student of Banan and Ian, and basically she did good support for us when it comes to literature search. Thank you so much, and you have a wonderful day.
Thank you, Abir. Now we're going to move on quickly on to Dr. Andrea Bruno-Tomei, who is a project manager and lecturer at the Faculty of Pharmacy and Pharmaceutical Sciences of Monash University, and is part of the Workforce Development Group 5 Competency Development. Thank you, Andrea.
Thank you, Jared. And in the interest of time, I'll try to be quite quick in my presentation. First of all, good morning, good afternoon, and good evening. I know that we have participants from across the globe, so thank you for joining us in this fabulous launch. I have the good fortune to present on behalf of my team. Next slide, please. Which hopefully is on the slide. Dr. Naoko Arakawa and Dr. Ariana Mestrovic are also global leads for the competency development, the WDG 5, or in this case, the development goal 5. In the next slide, we're talking a little bit about what is it in terms of the workforce itself, and what globally we have and why we're launching the reference guide. So it's about clear and accessible developmental frameworks that describes the competencies and the scope of practice within all the stages. And in a sense, the competency development encompasses all, if not most of the DGs that we've talked about and were launched at the beginning of last week. So I'm presenting not only things that we've done in the past, but also highlighting a few that we have done. already. So it's not a work that I've done only, we've done it as a team, and it takes all of us. So in the next slide, we're introducing why this is important and how, why we're doing this work. And of course, epic IT failure, there was some timer on the slide, so you can't see both graphics, so I do apologize for that. In a sense, what we want to explain with this slide and why we're doing this work is that the overall competence score in previous documented trials or pilots have increased. So what we're saying is that we should have competency development frameworks to support our practitioners, to support practice, to help us do better, perform better. And this work has been based on also initial work done by CODAG group, and all of the work that we've been developing since then has been based on the initial work that has been done by that group. So in a sense, what we want to say is that competency development frameworks help or accelerate complex competencies acquisition. Following on from that, next slide, please. The global competency framework was launched. The version 1 was launched back in 2012, which had, as you can see, 4 domains. It had roughly 20 competencies and had 100 behaviors, with the whole background of doing as a consensus through the member organizations, through practitioners, and we've developed the version 1. Moving on from that, what we've, sorry, next slide, please. What we've seen and why or how to use the global competency framework as a starting point, as a mapping tool. It really is to help us to define the scope of practice, which is often missed. It's the early years, it's the foundation level early years, the beginning of practice. It helps with translating the what and the how students and early practitioners can interact with the pharmaceutical care skills during that first 1,000 days of practice, as we normally say. It helps with mapping core outcomes for that initial education, and it has to work in synergy with other assessment tools. So by creating a portfolio, countries and also institutions can work together to develop a portfolio type of approach. What we trying to say is, regardless, it's not one size fits all, or it's not one global curriculum. It is about a needs-based approach. Next slide, please. This is just an overview. I'm not going to dwell into this part. It was just to highlight also the breadth and the collaborations we have been working with. So the developers, the implementers, or the linkers. What we mean is these groups have used the GBCF in some sorts of form, adapting, adopting, transforming it to their local needs, to their local settings. Next slide, please. One of just a highlight of how this has been useful and the impact or the overview of how several countries have used the GBCF in collaboration with other tools or working together with other tools has been highlighted in one of our reports. It's dated 2016, but this was just to give you an idea of how you could use, how to start doing or developing a global competency framework. Next slide, please. And of course, we had 2 very fabulous launches early last week, or the middle of the week. which was one of the sessions in our FIP virtual Congress. And I can say that the recording is already available. I've checked it, but we do now have 2020, we've launched the GBCF version 2 and the Global Advanced Development Framework. I'm coining these ones to the competency development as a whole, as overall, but these have specific development goals as well within their own, and the leads have done a fantastic job in presenting those. So I do encourage you to listen to the recording. Next slide, please. Sorry, this is really and why we're saying that it's the beginning of continuing for professional development. So competency in itself has amplifies the profession and amplifies not only the initial years but also the advanced stages of the professional development stage. So in a sense, we have as mandate for the competency development 5, all of it. So we collaborate with the other DGs as well as ensure that we are developing frameworks to support at different settings. Next slide, please. But what is the added value? Why is it important? Why competency development frameworks are important? And this is just a snippet of what we think it is relevant. For the individual, it's about development. It's about career pathways and identifying where they could go and how to achieve that. For professional bodies, it's about providing the support and the tool for the members. Regulators can be the interest in patient safety, the scope of practice as mentioned, as well as the measurement of competence. For the society, of course, we're always aiming for better outcomes, but it means that we have better trained pharmacists providing better care. And in global perspective, we always have approved in terms of our collaboration with WHO, as Ian and Lena mentioned already, and to adopt and adapt a policy in a way to accelerate the workforce transformation. Next slide, please. But how can we do that? This is just a possible model for competence-based education and training approach. This is an idea. It started with thinking about how we could present this as a steps, as a roadmap, as mentioned already today. So it's about looking at the needs assessment, needs-based assessment. It's about the development, it's about implementation, but also evaluation and monitoring. And this is part of the workforce transformation program. And I do encourage you, if you're interested in developing and looking at the work that has been done, to look at the website and get in touch with us to see what is it and how you can do it nationally or even individually in your own practice. But to an extent, this is why everything is connected to each other and how we can collaborate and ensure that we are helping each other and looking at the targets or measuring the targets in an equitable way. Next slide, please. I'm nearly finishing now, hopefully. So to summarize really the 5 key points, because it's number 5, that I would like for you to take home is, in order for them to be effective, they need to be applied. You need to see it in practice. When developing one, think about the overall strategy. It also needs to be credible and valid for early careers. It can also be a return to practice platform when we talk about career breaks or career changes even, and considering also the collaboration or the connection between DG number 10. We definitely need to pay more attention and support to our young and early career practitioners. It tends to be that what we have in practice is different from what they've learned, not completely different in a way, but it helps to support especially the increased complexity of medicines in the primary healthcare settings. it helps the young practitioners to have an idea or an aspiration for development of their own career. Next slide, please. Really at the end now. I would like to thank you again. As mentioned, this is not something that we've done on our own. It's about a team. It's about a collaboration. Definitely for the guru of competencies, Professor Ian Bates, the one and only. But also I'd like to thank my hub leads and the leads in the particular DGs to help me and allow me to borrow some of their slides that were presented before. So thank you, thank you, Lena, and thank you all the leads for helping us to do that. This is probably one of the oldest DGs that has been in development. So it seems that there's a lot of work, but it is about a lot of involvement and all collaborators and member organizations that have helped us and are still using them. The final slide, and I'm going to be very cheeky, and to say that competency is at the core, is at the center, because it does touch, it does link, it does connect with all of our DGs, not only the previous ones, but the ones that we have. So in a sense, one of the key messages from the opening ceremony was, it takes a village. I now say it takes the globe. It takes and it gives. It's a two-way street with competency at the center, of course. Thank you.
Thank you, Andrea. Now, we will now hear from Dr. Barbel Holbein. Dr. Holbein is a mentor with the FIP Women in Science and Education Initiative and a member of the FIP Academic and Industrial Pharmacy sections, and currently a global lead of the Workforce Development Hub #7 in services provision. Thank you, Barbel.
Okay, thank you, Jared. Hello to everyone around the globe. I'm excited to present on behalf of WDG7, Marwan Akel, Marit, XDN, and I. For the next 10 minutes, I will take you onto our journey from the idea of a survey to the Workforce Reference Guide. We will share with you our understanding of how service provision, education, and training might change. The outbreak has accelerated the transformation we were already experiencing. We have seen that at the front line, and we see the need and the opportunity not only to adapt, but to improve and to actively transform even faster. Oh, the next slide, Jill, please, or the first one. Yeah. Our group strongly believes that we must take advantage of these times now and shape the future of our profession. We started with a survey called Shaping the Future of Pharmacy to get an overall picture of services and to understand what's happening in different countries and even continents. The next slide, please, Jill. COVID-19 broke out, and immediately the pharmacy profession faced changes with respect to work, information, and service delivery. Governments too introduced changes. We are convinced by the unique opportunity to drive change within this accelerated transformation. Therefore, we proposed and developed a rapid response survey. Our colleagues in higher education were leading the way already. FIP colleagues and corporate partners like WHO requested answers to a lot of additional relevant topics. The next slide, please. To make the survey feasible, the FIP decided to break the original survey down into smaller surveys. Our survey is about impact of the pandemic on the services in community pharmacies and hospital settings, and on the continuity of care and the supply of medicines on a national level. The next slide, please. Our Corona-adjusted survey is structured in 4 chapters accordingly, as you can see here on the slide. It ran between mid-August to mid-September, and the preliminary results will be available very soon. We anticipate the final report at the beginning of next year. Next slide. In the meantime, the new FIP Development Goals and the FIP approach were developed to support the transformation of practice, science, education, and workforce. The next. Thanks. Now, to the next milestone on our journey, the Workforce Reference Guide. With the tools, method, and reports you can find in the reference guide, we strive to give answers to questions. Did we really learn any lessons during the outbreak? What existing services have to be adapted or improved, and how? Do we need to develop new services? And if so, what services do we need and what should they look like? Are we really prepared for the new normal? Which challenges will we face in the reset and which changes? Are we prepared for them? And it might be a little provocative. My perspective is from a high-income country. In the current reset discussion, I would like to ask whether we should finally rethink the healthcare system and transform it to what we need. And if so, in which areas and how? And what are the priorities? And there's another question I would like to stress here. How can we ensure research and pharmacy service and the delivery? The next, thanks. How do we meet the educational needs of pharmacists and pharmaceutical scientists to enable them to navigate the new normal? And who do we need to work with to adapt and implement education and training? Which gaps exist regarding leadership, work formats, and logistics? Next. We are aware of several gaps between authorities, in institutions, and between various providers of healthcare. Our aim is to provide practical resources for our colleagues at the frontline in practice, science, and education. And this is why we want you to get engaged, you as individual, independent on the organization, the level you are in, and the stakeholder you are with. Rethink pharmacy services, education, and training. The next slide, please. And give us feedback about the survey, its results, the impact, and the implications. Therefore, we set up the email address survey wdg7@fip.org. The reference guide is your source to promote health, to prevent illness, and to treat diseases. Next one. You get the results of the survey very soon. You get the first resources of the reference guide now. So please get involved now and become part of the transformation. Thank you.
Thank you, Barbel. And finally, we will now hear from Dr. Astrid Schock, CEO of the Interprofessional Association Quality Care and head of the Department of Education, Quality and Sciences at PharmaSuisse, the Swiss Pharmacy Association, and Workforce Development Group 8, working with others. Thank you, Astrid.
Thank you, Jared. I just want to correct something. I'm not working for PharmaSuisse anymore. That I used to work for PharmaSuisse 5 years ago. So, but I have the experience from that time. Hello, everybody, and I am very happy to be able to present our Workforce Development Goal number 8, working with others. Next slide, please. Together with my co-leads, Jill Boone and Silvana Nair-Leite. Next slide, please. Our vision is to globally have interprofessional healthcare teams with clearly identifiable elements of working together, as well as having interprofessional education and training in all workforce development programs and policies. What is interprofessional education? Interprofessional education is when two and more professions learn with, from, and about each other to improve collaboration and quality of care. The stress is learn with, from, and about. Everything has to be done together. And in practice, this goes into interprofessional collaborative care. It is in analogy also when two or more professions work together to provide comprehensive services by working with people, their families, and care providers. This does not mean that the doctor, the GP with his medical assistant, or the pharmacist with his pharmacy technician is interprofessional collaborative care. This means a GP together with a pharmacist, together with a nurse, working together for the patient. Next slide, please. And coming over to the FIP development goal, working together, working with others, interprofessional collaboration is key to success, and it is the future. In view of the One FIP strategy, we have to work together across FIP, we have to cut down the silos, as Catherine Duggan already mentioned. We have to work together across cultures and across professions. We have to work for better healthcare and definitely for the benefit of the patient. We should never forget this. I just want to make aware that even if when cutting down the silos, we will be more effective, but it will take time because working interprofessionally has to be learned. Next slide, please. And interprofessional education and collaborative practice is, we can use that in practice, in science, and in education. In the practice, due to the demographic developments, we will need more and more interprofessional care. We will not be able to achieve the goal of one health or health for all if we don't work interprofessionally. And interprofessional collaboration can overcome the lack of healthcare professionals. We have to learn how to delegate the services provided. We have to learn how to distribute the services among the healthcare professionals that are available in the respective settings. In science, interprofessional collaboration is possible. It can facilitate the development of effective medicines and treatments. For example, now during the COVID-19 pandemic, a lot of pharmacy industries opened their databases for their molecules to facilitate and to promote the prospective candidates for vaccines and medicines. This is also the first time they did something like this. In education is the basis because we have to learn how to work with each other. It has to be taught. Working with others is new. We have to get used to this, and education is necessary in order to know how to work with others in practice and science. Next slide, please. What our group is preparing is a self-assessment and readiness tool. Why are we doing this? It is to assist organizations to assess how far they are on their way, on their road to interprofessional education and collaborative practice. What is it? It's a survey-style questionnaire to assess this readiness. And for whom is it? It is for healthcare professional schools, universities, postgraduate and continuous education providers, or any organization involved in or aiming to be involved in IPE and IPCP. Where can it be applicable? It's for globally or regionally adaptable. Next slide, please. Now, our structure is also very important. Next slide, please. We have 3 different levels. We have we want to assess the readiness on a national level, country level, meaning we want to see, does the country have any policies or any incentives to implement interprofessional education and care? On an institutional level, this is the university level. Does the university have a policy? Does it have possibilities for the faculty to introduce or to work interprofessionally? Do they work with other institutions in preparing some interprofessional sessions? Do they have interprofessional practice sites, and on the lower level, on the level of the professional program and the curriculum, is there any interprofessional workshops which are compulsory? Are there only elective courses? Does the faculty have the possibility to be trained into interprofessional education or providing interprofessional education? This is our structure. Next slide, please. And now maybe to how do we develop our process? After looking at the literature, what is available, we have a bottom-up process, meaning that originally we have 3 countries preparing the basis. That is my co-leads and I from Brazil, Switzerland, and the US. And we got inputs from other areas, from Sarah, Desak, and Lena from their respective countries. After we worked through the first draft, we each contacted our respective colleagues from our network in our countries, which are from other professions. We specifically said we do not want to ask any other pharmacists at this point. We have other professions like nurses, GPs, specialist doctors, psychologists, physiotherapists, dentists, and they commented on this. Then we had some feedbacks from sociology professors regarding the survey methodology. Next slide, please. And now this is where we are. We are consolidating the feedback so far, which was very excessive and extremely valuable. And our next steps would be that we want to have some more validation rounds among the Workforce Hub leads, then also across FIP with AIM, BPP, and BPS. We are planning to pilot the questionnaire in different regions, settings, and professions. We were thinking about 10 to 15 different schools that would test the questionnaire and give us feedback. After the consolidation, we are planning to have a baseline survey globally, probably in the fall 21, and also introduce the tool to other healthcare organizations. This introduction has to be decided with the FIP leadership, because I think this is not up to us to do this introduction. This is has to be on the leadership level, CEO and president, and they have to also say when would be the best time to introduce it to the other healthcare organizations, other global healthcare organizations. It could also be before the baseline survey globally, but this is in discussion. Next slide, please. And I would like to thank everybody who is involved so far. You can see like there's quite a wide range of different professions and different countries, as well as our FIP internal colleagues helping. I want to thank everybody in the name of Jill and Silvana too, and I want to thank you, everybody, for listening and for your attention. Thank you.
Thank you, Astrid. And thank you again to all of our speakers from the Workforce Development Hub, to FIP for having the vision in creating the hub, to Ian and Lena for steering the hub, and to Catherine and Dominique for their leadership. And thank you also to Jill for moderating tonight. The recording of this event will be available in the WDG Hub landing page, which is on the screen at the moment. And finally, thank you all to the attendees tonight for coming along and hearing the great work that the Workforce Development Hub is delivering. The Q&A, unfortunately, we are out of time. We won't be able to address questions online, but we will make those available through the Workforce Development Hub as well, where this recording will be available. Thank you.
All right, Jared, thank you. And thanks all of our speakers, and hope that you all have a great day. Thanks.